Good morning, everyone. Welcome to our presentation. Today, we'll be exploring the important process of hospital admission and discharge. The title of our session is Hospital Admission and Discharge, and we might also touch on some key aspects related to patient flow and care transitions. Over the next few minutes, I'll walk you through what happens when patients enter and leave the hospital, highlighting best practices and critical considerations. Let's get started. Today, we'll be focusing on the key learning objectives for this section. First, we'll explain the concept of hospital admission and discharge, highlighting what these processes involve and why they are crucial in patient care. Next, we'll describe the nurse's role during both admission and discharge, emphasizing how nurses ensure smooth transitions and optimal patient outcomes. We'll also discuss the medico-legal aspects involved, which are essential to understand for maintaining legal and ethical standards. Finally, we'll identify the different types of discharge and the procedures associated with each, so you're familiar with the various scenarios you might encounter. Connecting all these points helps us appreciate the full scope of patient management from admission to discharge, ensuring we provide comprehensive and safe care throughout the hospital stay. Today, I want to talk about admission to the hospital, which is a crucial step in patient care. When we say admission, we mean the entry of a patient into the hospital setting to undergo diagnosis and treatment. It's an essential process that ensures patients receive the proper care they need. The main purposes of hospital admission are to provide care and treatment, to accurately diagnose the illness, and to ensure a safe environment for recovery. There are different types of admission to consider. Emergency admission happens when a patient requires immediate care due to urgent health issues. Routine or planned admission, on the other hand, involves scheduled procedures or treatments that are arranged in advance. Lastly, transfer admission occurs when a patient is moved from one facility to another, often to access specialized services or higher levels of care. Understanding these types helps us appreciate how flexible and patient-centered hospital admissions need to be. It's a fundamental part of the overall healthcare process, ensuring that every patient gets the right care at the right time and in the right environment. Let's talk about how to prepare the unit before admitting a patient. First, it's essential to ensure that both the bed and the entire unit are thoroughly clean. A clean environment promotes safety and comfort right from the start. Next, you'll want to organize the admission kit and all necessary articles, so everything is ready and within easy reach. This helps streamline the admission process and makes the patient feel welcome. It's also very important to maintain the patient's privacy and comfort throughout this process. Respecting privacy not only complies with ethical standards, but also helps the patient feel secure. Lastly, prepare all identification materials, such as the ID band and the name board. These identifiers are crucial for accurate patient identification and prevent any mix-ups during care. Overall, these steps are vital in setting a positive tone for the patient's stay and ensuring that everything is in place for a smooth admission. Today, I'll be talking about the concept of an admission bed. So when we refer to an admission bed, we mean a bed that's specifically prepared to receive a newly admitted patient. It's a crucial step in ensuring the patient feels welcomed and comfortable right from the start. Now, let's go over the preparation steps. First, we need to make a clean open bed. This means ensuring the bed is tidy, properly made, and hygienic, creating a welcoming environment for the patient. Next, we should provide a chair and a locker nearby. These are essential for the patient to keep their belongings secure and have a place to sit if they need to. It's also important to place the call bell within easy reach of the patient. This way, they can easily call for assistance whenever needed, promoting safety and independence. Lastly, keeping the admission file ready is vital. Having all the necessary documentation at hand helps us to process the admissions smoothly and efficiently. These steps are all about creating a comfortable, safe, and organized space for the patient, which ties into our overall goal of providing compassionate and professional care from the very first moment of admission. Let's walk through the admission procedure, which is a crucial first step in ensuring patient comfort and safety. First, we warmly receive and welcome the patient, creating a friendly and reassuring environment. Next, I introduce myself and give a brief orientation to the unit, helping the patient feel more at ease and familiar with their surroundings. Then, I verify the patient's details carefully to ensure all information is accurate and up to date, which is vital for providing the right care. After that, I record vital signs such as blood pressure, pulse, temperature, and respiratory rate, along with measuring height and weight. These are key indicators of the patient's health status. I also assist the patient with personal care if needed, promoting dignity and comfort right from the start. Finally, I complete all necessary documentation thoroughly, which is essential for maintaining accurate records and ensuring seamless communication among the care team. Remember, each of these steps plays a vital role in setting the foundation for quality care throughout the patient's stay. When admitting patients, especially those who are unidentified or unconscious, it's crucial to record all details carefully. This helps ensure that we have an accurate record, which can be vital for their ongoing care and legal considerations. Next, if the patient has valuables, make sure to document them properly. This way, there's a clear record of what was received and handed back later, preventing any misunderstandings. Obtaining informed consent is another key point. It's essential to explain procedures and get the patient's or their guardian's permission whenever possible. This respects their rights and helps protect us legally. And of course, maintaining confidentiality throughout the process is fundamental. We must safeguard patient information at all times, respecting their privacy and adhering to legal standards. All these steps are interconnected and reinforce the importance of professional and ethical care. They not only protect the patient, but also us as healthcare providers, ensuring that we uphold the highest standards in medical practice. Now, let's talk about the nurse's role during admission. First, it's important to prepare the bed and the unit ahead of time, making sure everything is clean, comfortable, and ready for the patient. This helps create a welcoming environment right from the start. Next, when the patient arrives, we receive and orient them to the surroundings. Explaining what to expect and showing them around helps ease any anxiety they might have. Accurately recording information is also critical. We need to document their details, medical history, and current condition carefully to ensure proper care throughout their stay. Communication with the doctor is another key point. We keep them updated on the patient's status and relay any concerns or important findings. And finally, providing emotional support is essential. Being empathetic and attentive helps patients feel cared for and understood, which can significantly improve their overall experience. All of these steps are interconnected and contribute to a smooth admission process, setting the stage for effective care and positive outcomes. Now, let's talk about discharge from the hospital, which essentially means the termination of care and services provided to a patient. This is a crucial point in the patient journey, and understanding the different types of discharge helps us manage this transition effectively. First, there's the planned discharge, which is carefully coordinated in advance. This might happen when a patient has recovered sufficiently, and the care team and patient agree it's time to go home. Next, we have LAMA, or leave against medical advice. This occurs when a patient chooses to leave the hospital despite medical recommendations to stay. It's important to document this thoroughly because it carries medico-legal implications and affects ongoing care. Then there's absconding, which refers to situations where a patient leaves without informing the hospital or obtaining formal discharge. This can pose challenges for follow-up and continuity of care. Finally, we have referrals and transfers, where a patient is moved to another facility or specialist for further management. This ensures they receive the appropriate level of care that might not be available at the current hospital. Understanding these different discharge types helps us ensure a smooth transition for patients, maintaining their safety and well-being as they move on from our care. Let's talk about discharge planning. This is a crucial process that ensures continuity of care after a patient leaves the hospital or care facility. The main goal here is to make sure that the patient continues to receive the support and services they need to recover fully. First, we assess the home needs of the patient. This involves looking at their living environment, available resources, and any potential barriers they might face in managing their health at home. Next, education plays a vital role. We need to clearly communicate information about their diet and medications, why they're important, how to take them properly, and what to watch out for. This helps empower patients to manage their health confidently. Arranging follow-up is also key. We set up appointments or check-ins to monitor progress and address any issues early on. It helps prevent setbacks and keeps the recovery on track. Finally, coordinating with community services is essential. Whether it's home health care, social services, or support groups, connecting patients with these resources ensures they have a comprehensive support network beyond the hospital. All of these components work together to create a smooth transition from hospital to home, which is ultimately what we aim for in effective discharge planning. Let's walk through the discharge procedure, which is a crucial part of patient care and ensuring a smooth transition from hospital to home. First, we need the doctor's discharge order. This is the official clearance that the patient is ready to leave, confirming that all medical requirements have been met. Once we have that, the next step is to inform the patient and their relatives about the discharge. Clear communication here is key to make sure everyone understands the next steps and any ongoing care needs. After that, we need to settle the bills. This step ensures that all financial matters are taken care of before the patient leaves, avoiding any confusion later. Then, we return any valuables the patient might have left with us, jewelry, money, or personal items, to ensure their belongings are safe and returned. Next, we take the time to explain home care instructions. This is vital because it helps the patient and their family understand how to manage recovery at home, medications, follow-up appointments, and warning signs to watch for. Following that, we remove the ID bands, which are no longer necessary once the patient is discharged. And finally, we document all the discharge details thoroughly in the patient's records. This documentation is important for continuity of care and for legal and administrative purposes. Overall, a well-managed discharge process helps ensure patient safety, satisfaction, and a smooth recovery at home. When it comes to medico-legal issues in discharge, there are a few key points we need to keep in mind. First, for patients who leave against medical advice, or LAMA, it's essential to obtain a signed consent form. This helps protect both the patient and the healthcare provider by clearly documenting that the patient is aware of the risks and has chosen to leave. Next, it's important to record the patient's discharge condition accurately. This means noting their health status at the time of discharge, any instructions given, and the patient's understanding of their care plan. Proper documentation ensures clarity and accountability. Finally, maintaining the confidentiality of records is paramount. Patient information must be kept secure and private, respecting their rights and adhering to legal and ethical standards. All these points tie back to the overall theme of providing safe, ethical, and legally compliant care. Proper handling of discharge procedures minimizes risks and ensures that both the patient's rights and the healthcare provider's responsibilities are protected. Now, let's talk about the nurse's role during discharge. First and foremost, it's important to prepare the patient both physically and mentally. This means ensuring they feel ready and confident to leave the hospital, which can really impact their recovery at home. Next, we need to clearly explain home care and follow-up instructions. Making sure the patient understands what to do and when to seek help is crucial for preventing complications. We also need to ensure all belongings are returned to the patient, so nothing gets left behind or lost. Accurate record-keeping is essential. Documenting all relevant details about the discharge process helps maintain continuity of care. Finally, providing health education is a key part of our role. Empowering patients with knowledge about their condition and care plan helps them take charge of their health and promotes better outcomes. Remember, a thorough and compassionate discharge process not only supports recovery, but also reinforces the trust and confidence patients have in their care team. Now, let's talk about the important steps involved in caring for the unit after a patient is discharged. First, it's essential to send linen for laundry. This helps maintain cleanliness and reduces the risk of infection. Next, we need to disinfect the bed and furniture thoroughly. Disinfection is crucial to eliminate any germs or bacteria that might remain. After that, replace any articles or supplies that were used during the patient's stay, ensuring everything is clean and ready for the next patient. We also prepare the bed for the next patient, making sure it's properly made and comfortable. Lastly, it's vital to document all cleaning activities. Proper documentation not only keeps records accurate, but also supports ongoing infection control efforts. Overall, these steps are key to maintaining a safe and hygienic environment in the healthcare setting. Let's wrap up with a quick summary of the key points we've covered. Admission and discharge are truly vital nursing procedures because they mark important transitions in a patient's care journey. It's during these times that clear communication and accurate documentation become absolutely essential to ensure everyone is on the same page. As nurses, our role is to make sure that patients feel comfortable and safe throughout these processes and that their care continues seamlessly. Remember, effective communication and thorough documentation are what uphold the quality and safety of patient care, connecting all the different aspects of nursing practice we've discussed. Now, let's take a look at the references that have supported the information presented in this course. First, we have Cozier and Erb's Fundamentals of Nursing, which is a highly respected resource that covers the core principles and practices essential for nursing students and professionals. It provides a solid foundation in nursing theory and application. Next, Potter and Perry's Fundamentals of Nursing offers comprehensive insights into patient care, emphasizing both the scientific and humanistic aspects of nursing practice. It's a valuable resource for understanding how to deliver holistic, patient-centered care. We also reference the INC nursing syllabus, which is important because it outlines the standards and curriculum guidelines that shape our nursing education and ensure we meet the necessary competencies for safe and effective practice. Connecting all these sources helps reinforce the importance of a well-rounded, evidence-based approach to nursing. They collectively support our overall goal of preparing competent, compassionate, and knowledgeable nurses who can adapt to diverse clinical situations. Remember, referencing credible sources is crucial for grounding our practice in proven knowledge and continuous learning.